Are you wondering what really causes hip pain? In this video, we're going to look at some of the facts and the fictions around the true causes of hip pain. I'm Matt Shu from Upright Health, where we help you move beyond your limitations so you can live with confidence. Be sure to check out the description box below for helpful links to videos, do-it-yourself programs, and our live workshops. And while you're down there, look at that subscribe button really hard and really close and think about clicking it. In my 20s, I started having really severe bouts of hip pain that just started becoming a daily part of my existence. My hips felt like they're burning and aching all the time, as if I had a toothache inside. Sitting on hard surfaces started to get really uncomfortable, and eventually soft surfaces became really uncomfortable. And even just sitting in a car for a couple of minutes felt like I needed to climb out of my own skin because everything was aching and just feeling so crappy. So I've made it my personal mission to help other people get their hips feeling better. And to do that, you need to understand what really causes hip pain. And so we're going to look at some of the things that doctors say cause hip pain and look at what the research actually says and what you can do to help yourself. If you've ever consulted with a medical professional, a PT, a surgeon, or just your primary care physician for hip pain, you may have heard that there are some pretty common causes of hip pain, and they're the ones that are usually going to be tested in a medical environment. So there is bursitis, there is arthritis, there is labrum tear, and there is femoral acetabular impingement, which sometimes gets kind of thrown into the mix as a cause of labrum tears and arthritis and all that kind of stuff. Now, that right there is already one of the big myths that will make it difficult for you to get out of hip pain. If you want more information about those diagnoses, check the description box for a link to a video that I did about those issues and those diagnoses. But the long and the short of it is that those diagnoses, when you look at the science, have absolutely nothing to do with actually experiencing hip pain. You can have arthritis, severe arthritis in an x-ray and have absolutely no symptoms. You could have FAI, femoral acetabular impingement, and no symptoms at all. You could have a labrum tear for your entire adult life and have absolutely no symptoms. And bursitis, well, there's no really good imaging way to check for it beyond you're telling somebody, well, my hip hurts. So that's going to bring us into the next part of this video. Here's the trick. When you go to a doctor and you say, I have hip pain, I want to do something about it, the doctor has a set of diagnoses that all set you up to be helpless. So for example, if somebody says you have bursitis, then what are you going to do? You need to rest. If that doesn't work, then maybe an injection or maybe stronger medications and more rest. If you have arthritis, the strategy to deal with that is currently more rest. Maybe you need some sort of injection to ease the pain and help you function better, or use a cane because your hip is damaged and just can't get any better. If you have FAI or a labral tear, then you need to also rest and take it easy and stop using it so much. All of these go counter to your original goal of being able to move more and to continue to enjoy your life. So you have to realize that if you use these diagnoses as a way to solve your problem, the only thing that you're going to end up being told is you need to rest or have something more invasive done to you. A classic example of this is a story I heard from a client. He was told that sitting deep in a squat would cause arthritis and make his hips much, much worse. And what you have to realize is that when doctors say this, they're often saying things with good intentions, but they may not have looked at things from a broader perspective. Countries where people sit in deep squats all the time actually have senior age adults who are able to sit in deep squats for long periods of time without any issue, and they'll actually be able to do work in this position all day long without any deleterious, damaging effects to their hips. So that right there should tell you maybe something about the way we're looking at hip pain and hip pain relief strategies in the Western world don't really make sense. So what are you supposed to do if you have chronic, recurring, annoying hip pain? Well, the most productive strategy that I've seen in my life and with my clients is to start working on improving control, mobility, and strength all around the hip. Focus on the muscles instead of thinking about the medical diagnoses. Since we already know those medical diagnoses don't actually line up with pain, they don't have any correlation to somebody experiencing pain, we need to look somewhere else. And we know muscles can give you pain signals. We know muscles will hurt if they're not strong enough. We know muscles will hurt if you annoy them for long enough, and if they get too weak, and if they get too atrophied, muscles will tell you so. It's a normal, observable, obvious issue. So, one thing that you can do is what I'm doing right now, which is learn how to stretch in different ways. So really good stretching ideas you'll find in our hips playlist, and you can go check those out. Right here, what I'm doing, you may not be able to get into right away, but it's something that you can work towards. It will initially feel like, no, that's impossible. How could that hip possibly do that? Everything that you start trying the first time when it's difficult, mentally you're gonna say is impossible. But I guarantee as you try things and gradually work towards them, you'll be able to make huge progress. Just don't let fear and an obsession with medical diagnoses scare you away from improving control of your own body. Alright guys, that's going to do it for this video. If you're looking for ideas to help you move your hips better and get relief from hip pain in a way that's sustainable and that puts you in control, be sure to check the description box for helpful links to our do-it-yourself programs as well as workshops that we're putting on in the future. If you like this video, be sure to click the like button and share this video with somebody that you know will click the like button too. And if you don't want to miss any of our future videos, hit the subscribe button and then that little bell icon to make sure you get notified of our future videos. And as always, I hope you remember that pain sucks. Life shouldn't. Oh man, that's a good stretch. That is a good stretch.